happens. Healthinsurance.org estimates that South Carolina is leaving more than $2 billion on the table. That's money that could be used to get more people to the doctor. More numbers for you to kind of digest. More than 1 million South Carolinians are covered by Medicaid, or the children's version of Medicaid. By expanding Medicaid, it would allow more than 345,000 people to gain health insurance coverage. Back in 2021, just last year, the U.S. Census report found that 13% of South Carolinians did not have health insurance. That's more than 660,000 people without insurance to go to the doctor. Now, earlier this week, President Biden signed the Inflation Reduction Act into law. It includes provisions for climate issues, taxes, and even some health care. But a gap remains in coverage, and that's impacting thousands of Palmetto State residents who are now in the 600,000 who are uninsured. News 19's Becky Buds has that story.
For years, Michaela Goldstein qualified for Medicaid and disability in California due to some pre-existing medical issues.
I've been hospitalized probably somewhere between 20 and 30 times in the last 15 years.
When she moved to South Carolina to pursue a graduate degree, her coverage options changed.
I qualified for other insurance, but not insurance that I could afford, and even the insurance that was the lowest cost had like a $9,500 premium.
9 months and thousands of dollars in unpaid medical bills later, Goldstein is still uninsured. Without insurance, her only access to health care are free clinics and emergency rooms.
The idea that I may have to go into a hospital and can't afford it and don't have any other options is just terrifying.
Goldstein's story is one of many. According to the South Carolina Appleseed Legal Justice Center, thousands of South Carolinians fall under the so-called health insurance coverage gap.
There is a whole population of individuals who are too poor to go into the Affordable Care Act, yet are not eligible to go into Medicaid.
Director Sue Berkowitz explains those who are not eligible for Medicaid are mostly low-income adults without children or working families with children.
We know that when people are healthy, they can succeed. When somebody is healthy enough to then go to work, they're able to get ahead.
Berkowitz says South Carolina is one of 12 states that have not expanded Medicaid coverage to cover people who live below the federal poverty line. In a statement to News 19, Governor Henry McMaster's office said, quote, instead of irresponsibly spending hundreds of millions of dollars on Medicaid expansion, South Carolina has taken a better approach, investing directly in our people's education and workforce training so that welfare isn't necessary in the first place. Goldstein hopes in the future the gap will be closed.
It's a broken system. It's a system that doesn't insure the people who probably need the healthcare system the most.
In Columbia, Becky Buds, News 19 WLTX.
We're wrapping up Immunization Awareness Week in South Carolina, and today health leaders gathered at MUSC's Children's Hospital in Charleston to discuss the importance of vaccinations. DHEC Director Dr. Edward Simmer also recognized the winners of this year's Immunization Champion Award. He says that vaccines have saved millions of lives, and it's important for everyone to stay up to date on their vaccinations to protect themselves and others from many different diseases.
I want to encourage everyone to think about how fortunate we are that we have access to these great vaccines and the opportunity to make sure that all of ourselves and our families are protected against infectious disease. Talk to your doctor, talk to your pediatrician, and make sure your children are up to date. And make sure you're up to date, because vaccines are not only for children, right? There's important vaccines for adults, even folks my age. Shingles vaccine, pneumococcal vaccine, very important to help protect our elderly against disease.
Students are required to be up to date on certain vaccinations to attend school and childcare. These requirements include the hepatitis A vaccine for second graders and the chickenpox vaccine for 8th graders. 10th graders must now have 3 doses of a polio vaccine with at least 1 dose received on or after their 4th birthday. DHEC says these vaccines are not new and are one of the most successful public health interventions for reducing disease. And health professions continue to urge parents, health professionals, I should say, urge parents to get their children vaccinated against COVID-19. According to the World Health Organization, COVID-19 vaccines have saved 20 million lives across the world. The CDC has updated its community COVID levels map. Here in the Midlands, 3 counties have dropped to low levels of the virus spread. They are Lee, Sumter, and Saulda counties. However, Newberry, Fairfield, Lexington, and Richland counties remain at high community spread levels. That means that residents in those 4 counties should be wearing a mask when in public, especially when indoors. Officials with Clemson University say that 2 more horses in the state have tested positive for equine infectious anemia. There have now been 5 cases of the illness discovered in the past month. We're told that the virus is most often spread through a blood-sucking insect like a mosquito or a tick, but also spreads through infected needles and other medical equipment. The disease is not a danger for